So, fun fact about me, I struggle with erectile dysfunction. As I try to turn back the clock on aging, finding a solution to this ailment has been a bit of a holy grail. But recently, I came across a new promising development in the battle of the boner that just might be the answer to my prayers, and maybe yours as well. If you want to slow, stop, or even reverse the aging process, if you want to live longer and look better, if you want to turn back the clock on aging, then you really might want to consider hitting that subscribe button below and subscribing to this channel. And while you're at it, leave a comment and let me know what you think of this channel and the content that it provides. Let me know what topics you'd like me to do a video on. Hit the like button and hit the bell to be notified whenever I post a new video. In this video, we'll start off by talking a bit about erectile dysfunction and what you can do about it, erectile dysfunction treatments. Then we'll jump into this exciting new treatment, what it does, and how it works. You know, the reason I started this channel was to share my experience as I tried to turn back the clock on aging. And of the many issues that I'm dealing with, one of the biggest has always been ED. How to cure erectile dysfunction due to aging, the quest to stay harder longer. Now, I've talked to a lot of guys in their 50s and 60s, and all of them admit to struggling with ED. All of them. And they all want to know how to have better erections. Now, statistics say that 50% of men in their 50s and 70% of men in their 70s have ED, which apparently means that a whopping 30% of men in their 70s just don't have ED at all. I don't know, that seems dubious. I think that all aging men have erectile dysfunction. I think that erectile dysfunction is just an inevitable, crappy part of the aging process. If you agree or disagree, leave me a comment. And if you're willing, let me know if erectile dysfunction is something that affects you as well. Again, I kind of suspect that all aging men suffer from this disease in some form or another, but I'd like to know for sure. If you're a 50-year-old guy with a magical 20-year-old penis, please feel free to correct me, brag in the comments, or hey, maybe donate your penis to science. Regardless, there are a lot of things that we can do to restore erectile function. Optimizing our hormones is a great place to start. Now, I almost tripled my testosterone levels, and that definitely helped a bit. Then there's medications that you can take, like Viagra, Levitra, Cialis. They work on the plumbing, but I've read reports that state that only about 20% of men experience any kind of major improvement, and I'm in the 80% that doesn't. Now, another medication is bremelanotide, better known as PT-141. I did a video on that a few weeks ago, and I'll put a link in the description. Now, PT-141 works on the libido, and I've actually had a much better experience with PT-141 than with Viagra or Cialis. But you have to inject PT-141, not like into your penis, but still, that kind of sucks. Now, you can stack your treatments. You can boost your testosterone, you can take Viagra or Cialis, and you can inject PT-141. Now, again, not in your penis, seriously, don't do that. And all that works pretty well. That's where drugs like Viagra or Cialis actually work for me. That's probably the closest I've come to getting back to where I was in my 20s and 30s. But once the drugs wear off, you're right back where you started. But all of that might be changing if you can afford it. A while back, I came across a new development in the technology for treating erectile dysfunction, a new ED treatment that after a single use not only claims to work for up to 1.5 years, but also claims to grow the penis in size, making it bigger. I know, right? Now, I've always worked on the assumption that if something sounds too good to be true, it probably is. But all the evidence seems to point in the other direction. This new treatment is called the Priapus shot, or P-shot, after Priapus, a minor Greek god of horticulture, livestock, and apparently dicks. Priapism, which is an erection that won't go away, is also named after this god. Now, as near as I can tell, this procedure was developed about 7 years ago by a doctor named Dr. Charles Runnels. This is the same guy who also developed the vampire facelift, and he developed a similar procedure for women called the O shot. In the first procedure ever performed, the good doctor injected his own penis just to see whether or not it was safe for his patients. And yeah, this one is injected directly into the penis. So the P shot and the O shot are based on a medical procedure using PRP, platelet-rich plasma. PRP therapy has been around since like the 80s, I think. The idea is that a person's own blood is drawn and placed in a centrifuge to separate out the red blood cells, the plasma, and the platelets. The concentrated platelets are then injected back into the area that needs healing. The platelet-rich plasma then releases growth factors that stimulate cellular regeneration and accelerate tissue repair. Now, this process has seen a lot of success, particularly in dentistry and treating sports injuries. Athletes like Tiger Woods and Steph Curry have used PRP therapy to overcome some pretty debilitating injuries. So now you can use those same procedures to overcome erectile dysfunction, but it ain't cheap. The P shot comes in at around $2,000. Now, when you consider that it lasts for up to 12 to 18 months, that can be as little as $110 per month. I know a lot of guys who are already spending more than that on their ED medications. But does it really work? I don't know, maybe. I haven't done it yet, but I'm planning on doing it, and when I do, I'll definitely let you guys know how well it worked. In the meantime, all I have to go on is anecdotal evidence, but that evidence is pretty darn good. So obviously, one of the benefits is a stronger, firmer erection. Now, doctors use a test called the Sexual Health Inventory for Men to determine the severity of a patient's erectile dysfunction, and the best possible score is 25 points. The P shot claims to raise a patient's score by 5 points on average. It also claims to improve sexual stamina by making it easier to achieve and maintain erections. It increases sensitivity in the penis, and it may improve the quality of orgasms. Since PRP therapy works by accelerating the healing process, the P shot can also resolve penile pain with an erection, and it can be used to treat Peyronie's disease, which is a bending of the penis caused by the buildup of scar tissue. But most importantly, the P shot increases overall blood flow to the penis, opening small arteries and capillaries. And it does this without creating systemic vascular effects like Viagra, Cialis. And because of this, it also makes other therapies like Viagra, Cialis, and Levitra work more effectively. Nice. And here's the benefit that blows my mind. It can actually make your dick bigger, possibly by as much as 10 to 20%. 60% of men who got the P shot have claimed that they grew their length and girth by ½ an inch. I know, crazy, right? Most men who get the P shot experience results in 1 to 3 weeks, with the full effect taking place within 3 months. And the effects can last for a year to a year and a half. So how does this work? How does the P shot achieve these rather amazing results? Here's the science part of the video, and I put a timestamp in the description so you can jump ahead and skip this part if you want. Platelets are rich in bioactive proteins called glycoproteins that release growth factors. These growth factors stimulate a type of stem cell called a unipotent stem cell, which is a stem cell that only produces new cells in the adjacent tissue. The growth factors also enhance the migration of these new cells in and around the injection sites, repairing damaged cells and extending the life of existing cells, all of which contribute to tissue regeneration. The injections can also enhance the proliferation of fibroblast growth factors, which in turn can direct the healing of wounds and the formation of new blood vessels and capillaries. And they can also stimulate collagen production. Now, as with any wound healing, the rejuvenation of the penis involves numerous tissue types, such as blood vessels, nerves, smooth muscle fibers, lymph vessels, connective tissue, endothelium, and so on. When the penis receives a concentrated blast of bioactive glycoproteins and fibroblast growth factors from a PRP injection, it immediately cranks up the generation of new tissue, not only in the erectile tissue, but throughout the entire penis. Think of it like this. As you age, the function of the penis declines due to a lot of different reasons. Loss of blood flow due to diminished capacity of the arteries and capillaries, a decline in the sensitivity of nerves, an inability of the endothelium and the smooth muscles to release nitric oxide. The injection of platelet-rich plasma and the growth factors that they release starts the healing process of these tissues, repairing cells that can be repaired, eliminating cells that are old and worn out, and replacing them with new cells, resulting in the generation of new tissue, new smooth muscle tissue and new endothelial tissue, new blood vessels, and repaired nerves. All of this new repaired tissue leads to improved erectile function and a larger penis, apparently. Now, as I mentioned, I'm thinking about getting a P shot. As you might imagine, my two biggest concerns are the cost and the idea of getting an injection into my penis. But they use anesthesia and apparently it's totally painless. We'll see. At any rate, I'll keep you informed if I do. I'll probably put up another video right after I have it done, explaining the procedure in detail, and then another video after about 3 months, in which I'll go into detail about whatever benefits I experience. So be on the lookout for those. Okay, that wraps up another video. Leave me a comment and let me know if you suffer from ED, if you're willing. I'd like to know just how prevalent ED is among us older guys. And if you've already had the P shot done, definitely leave a comment and let us all know how it went, how painful it was, and what benefits you experienced. If you enjoyed the content of this video, then please hit the subscribe button below and subscribe to this channel. Hit the like button. Share this video with your friends and on your social media. That's it, I'm out of here. Thanks so much for watching. I'll see you next week.